So hello everyone, welcome to Maa-Si Care Clinic's Ask Me Anything session on breastfeeding. Myself Dr. Tanima Singhal and welcome you all on today's session on Ask Me Anything on breastfeeding your baby. So let me start with the questions first. So many of you have filled the form today. So I'm just taking questions one by one, and till then you can write the questions in the chat box and I'll take the questions. So I'll start with the questions which have already come, and then I'll take the live questions. So if you have any questions related to breastfeeding your baby, you can please write them on the chat and I'll answer them. So first question is from Parul. Baby is latching well, but still feels hungry even if he's breastfeeding for an hour. So Parul, first of all, you have to understand the concept of active feeding and passive feeding. So what is active feeding and passive feeding? When you drink water or any liquid, you can see the gulping movement in your neck. So if you can see when the baby is feeding, if you are seeing the gulping movement in the baby's neck, that means that is an active feeding. But if you are not seeing the gulping movement, that means your baby is not swallowing milk. Baby is just moving the mouth. You would have observed your child even during the sleep time, the baby keeps moving their mouth. So that way they are not feeding that time, but they are moving their mouth. That is a reflex of small babies. So if you are seeing that the baby is gulping movement is not there, that means the baby is not taking active feeding. So if your baby is feeding for 1 hour, 1.5 hours, and still the baby is hungry, that means your baby has been doing passive feeding. So always ensure that your baby should be doing only active feeding. If your baby is not doing an active feeding, you have to remove your baby from the breast. So Parul, when you say that the baby is latching well, but still feels hungry, even after feeding for an hour, that means it is a very clear indication that your baby is doing a passive feeding. So try to do active feeding by improving the latch of the baby. That we can discuss anytime later. Now, next question is from Lakshmi. How to increase the quality of breast milk? So, breast milk is already very good in quality. It is basically the hind milk when we talk about. Fore milk and hind milk. Milk is in two parts. Fore milk is predominantly water and hind milk is loaded with fats. Fore milk is important for baby's thirst, for proteins, giving more of immunity to the child, while hind milk is loaded with fats. It improves the baby's weight and also it improves the baby's satiety. So when we talk about increasing the quality of breast milk, it is basically you have to give more hind milk to your child. And how you will recognize between fore milk and hind milk? Fore milk looks translucent while hind milk looks more pearly white in color. So this way you can differentiate between fore milk and hind milk. And also if you have to work on improving your quality of breast milk further, then have the lactation supplements which I suggest is Lactomagic powder and Morico tablets. Next question is from Shresha. How to increase supply? So Shresha, how to increase milk supply? There are few factors which you need to work upon. Number one is improving the hydration of the mother. So take at least 3 to 3.5 liters of water per day. Second, by improving the flow. So for improving the flow, you have to do oil massage and warm compress on the breast. Third is demand and supply. If you want to improve supply, you have to create demand for your brain to improve the milk supply. Next is by improving the nutrition of your body. Take protein-rich food, take lactation supplements like Lactomagic powder and Morico tablets. Morico is very good for improving the quality of breast milk, while Lactomagic is good for improving the quantity of breast milk. Next is you have to check your baby's weight. And last thing is keeping the baby skin to skin with you. Next question is from Neha. Is it okay if in daytime pumping is every 3 to 3.5 hours and 2 times at night? Will it affect the supply? So Neha, first tell me what is the age of your baby. If your baby is less than 3 months, I would recommend you pumping at least 3 hourly. So basically it will come around 8 pumps in 24 hours. And when we talk about the babies who are more than 3 months, then 7 times of pumping is more than enough. So this way you have to work, Neha. So when we talk 3 months, so 3 months, yes, one more thing, Neha. 3 months babies have growth spurt. So during this time, you will feel the baby would be more cranky, more fussy, so if the baby is more cranky, more fussy and doing frequent feedings, then I would suggest you to have the baby on the breast. If you are pumping, please continue the pumping what you are doing, but this is a good time where you can get the baby also on the breast. So try to put the baby on the breast even during the mid bottle feedings. That will help your baby to come on the breast directly also, if you are like trying to get your baby on the breast. So rest of that, you should at least have milk, at least like you have to express the milk 8 times per day, which is coming around 3 hourly. So if you are able to express the milk 8 times per day, then it is fine. But it will be better if you are doing it regularly, if you are improving the milk supply. Neha, if your milk supply is good, then whatever you are doing is fine. But if you are trying to increase the breast milk supply, then you have to do at least 3 hourly pumps regularly. Okay, Neha? Next question is from Medha. Medha asks, I am now in my eighth month of breastfeeding and will have to join office from January. What and how should I ensure that night feeding continues? Great question, Medha. So once you start your office from January, when you come back from your office, just wash your hands and take good hygiene, and then have your baby on the breast. So if you are doing demand feeding during evenings and during nights, the baby will continue doing the feedings. Don't worry that if you are not feeding regularly in the day, the baby will forget of breastfeeding. Baby will continue breastfeeding. That's not a problem with you. Okay. Next question is from Archie. How to make 2 years baby latch? So Archie, if your baby has not fed previously, like never latched before, because now it's a 2-year baby. So for 2 years baby, if the baby has breastfed previously, then it will be easier for you to latch. If the baby is already 2 years and have never breastfed, then first you have to work on improving the milk supply. And once the milk supply is good, then you have to try for like in between the bottle feedings or between the cup feedings or the glass feedings. You have to try for that. But 2 years baby latching will not be that easy, but it will take much efforts, but sometimes it can happen also. So this, but I will suggest you to work under some doctor, lactation doctors who can help you with latching tips for a 2 years old baby. Next question is how to introduce solid to baby at 6 months. So basically solid food introduction is very important, and always girls, I am making one thing sure, that don't try to introduce solids as fruits at 6 months. Why is it so? Because at 6 months usually babies are teething. So during the teething time, if you introduce fruits have natural sugar in them. So because of the natural sugar, there is a good medium of catching infection. So try to introduce. So I guide mothers for solid food guidance also. So the mothers who come to me for solid food guidance, I advise them to start fruits either at the 8th month or at least one tooth has erupted. Rest of that, when we talk about solid introduction, start at 2 meals per day at 6 months and 60 ml of water. The food quantity, like the consistency should be paste-like. It should not be like thin like dal pani and rice water. These I don't recommend. I recommend giving paste-like food. So start with dal, and then you can keep adding carrot into that, sometimes palak into that, and keep ragi adding into that. Always keep changing. 3 days rule you have to follow. For 3 days, you have to give one food only, and then keep mix and match. So this way, from different food groups, you have to add, from vegetable group, from seeds group, from nuts group you have to add. You have to add from cereals. You have to add from this grains. So this type of different food materials you have to start introducing your child. So babies whom I guide for into solid introduction, I add usually 8 food items in the first month. And in second month, I mix and match those 8 items which I have started at 6 months. And next month, I introduce more items. So this way, a lot of diversity you have to give to your child. This way, your baby will be like having diverse nutrition and will never be a picky eater or a fussy eater. Neha says, I am doing both due to working schedule. Thank you so much for the response. Most welcome, Neha. Next question is from Diu. How to know baby is full? Good question. So when you will see there are few things. See, it is not that easy if you want to know how to see the signs of it. This is between you and your child. Every baby is different. Some might leave the breast in between, some might complete the breast in between in full and then sleep off, and some will play. So how you will know that the baby is full? There are few things what you can do. You can, after breastfeeding, just press the breast and see the color of the milk. If the color of the milk is thick white coming, that means your baby has not completed the breastfeeding. So there are chances that the baby will be asking feeding frequently. But if you are seeing that the color of the milk has become translucent, that means that baby has emptied that breast. Now, if you see that still your baby is feeding frequently after half an hour or something, that means your baby's appetite at one go is not fulfilled by one breast. The baby will be taking the other breast also for all the feeding sessions. This way, you and your child have to understand each other. Don't go on internet things like you have to see the fist should be open, the baby's tummy should look full. These are very vague signs. You will be able to recognize this by studying your child. And more of this on a bigger scale, when I talk, you have to see the baby's weight gain. If the baby is less than 3 months, baby should gain around 200 grams per week. And if the baby is between 3 to 4 months, baby should gain at least 150 grams per week. More than 4 months up to 6 months, baby should gain around 100 grams per week. So if you are seeing the weight gain is happening, then you are good to go. Every day when I talk about, you can just check what I just told you, and that way you will be able to understand your child, and you can customize it as per you and your baby. Okay. Next question is from Ranjesh. Hello, doctor. Can my 6 months old baby latch for the first time? So we have to work. As I told you, see, every child is different. Recently, one of my 10-month-old baby came on the breast. So, and the baby had never breastfed previously. So if the 10 months old baby can come on the breast now, because your baby is just 6 months old, so there are chances that you can improve the breast milk supply. Sorry, the chances of getting the baby on the breast can improve if your milk supply is good. You can just check on my YouTube channel. Recently, one of my story of Mrs. Parul, her baby was only on bottle feeding. The baby has come now on exclusive breastfeeding. So you can check out that video, that success story. So everybody, you should definitely go on my YouTube channel and watch all the Mom Star series. I put all breastfeeding success stories on YouTube also. So that will be very inspiring and motivating for all the mothers who are facing any kind of breastfeeding issues. So on YouTube, just type my name, Dr. Tanima Singhal. You will get my channel and watch the Mom Star series. So I have made one series where I post successful mothers interviews on that channel, on that playlist. So watch them. You will really feel so good that there are so many mothers having so many difficulties, but they just moved ahead with their full courage and willpower, and they were able to get their breastfeeding success stories. So all of you watch the success stories on my YouTube channel and be very confident that you can exclusively breastfeed your babies. Next question. How much ml of water can be given to a baby? So when we talk about 6 months, we have to start at 6 months of completed. So at 6 months, start with 60 ml of water per day for your child. Next question is from Adar. I am exclusively breastfeeding my baby, but facing low supply of late. How to increase? So if you are facing low milk supply of late recently, just work on improving the demand. So after every breastfeeding session, just hand express, or you can just palm for a few minutes. This way you will be able to improve the demand. And once the demand is improved, the milk supply will definitely increase. For a few days when you are feeling that you have to really work on that, you can include lactomagic powder and Morocco tablets. These two things you can include. That will help to do it faster. That's all. Otherwise, just improving. And yes, your water intake. Take 3 liters of water every day. So these 3 things and just working on improving the demand, that supply will definitely increase. If you are an exclusively breastfeeding baby mother, then it will not take much time. Just few days and it will be all okay. And also, if you are checking your baby's weight and the baby's weight is increasing regularly, then don't worry about the supply. Your supply is all good. It is basically, we as mothers always worry about our babies, that my baby is not drinking well, my baby is not eating well. But it is not like that. Just check the baby's height and weight. If the baby's weight and height is increasing, specifically, I talk about height when we talk about 3 months plus babies. So you have to check both height and weight. See, because for growth parameters, height and weight both are important. So if your baby is gaining weight and also gaining height, because it depends on the parent structure also. If the parents are lean and thin, and how can you expect your baby to be too fluffy or too like chunky types? So that way, just try to see the baby's height. And if the baby's height is also increasing, then don't worry if the baby is lean and thin. Your baby should be healthy baby. So try to give more of breast milk to the baby. As you all can understand formula milk, when we talk about what it is formula milk, when we talk about the name itself says formula, it is all synthetic. There is no such so much of milk in the world to make it for humans, for elders also. How can we make one dabbas which get finished up in every 3 to 4 days? So please work on improving the breast milk supply and work hard on it. And it is not that difficult. You have to just understand the basics of breastfeeding. And don't get confused by seeing internet or by Google. Try to go and to an expert and get your issues resolved fast. Breastfeeding is like, obviously there are only 6 months in the beginning, and later on obviously the baby starts having solids. So there is a very small window. You have to take action fast and get your issues resolved fast. So don't keep thinking about, should I go for internet or should I go for some free internet knowledge, for some free tips? Please don't think about it. Your child is your priority right now, and giving a good foundation is the most important thing. And giving your breast milk is the best thing you can do for your child. That is a tailor-made milk for your child. So just try to get your baby on exclusive breastfeeding. Next question is from Adit. I want to store breast milk as I am going to join office in a month. So that's perfectly fine. Just start storing your breast milk. What is the problem in that? Next question is from Smita Davare. My breast secretes only 20 ml of milk after taking other Ayurvedic medicines. Otherwise, it secretes only 3 to 4 ml milk. So, Smita, see, when you are checking the milk by pumping and seeing 20 ml and getting discouraged, don't worry by this way. See, pumps are not natural things, na? Your brain is accustomed for babies feeding. Now, when you are doing pumping once or twice, or like once you have done 2-3 days, you have not done, when you are giving like not regular reflexes to your brain, the brain will not understand that. So if you are doing pumping, you will have to do it regular intervals. And for few days, you have to regularly do that. So your brain understand that reflex and start releasing the milk. So I'll guarantee you, if you're doing it regularly on regular intervals and doing it regularly for 1 week, you will definitely see the increase in milk supply. So please don't worry that you are pumping once and you are getting 20 ml and getting discouraged. Don't worry that way. It is never about doing once and twice. You have to work on it consistently for few days. And once you start seeing your milk supply going up, then you will feel so confident. And one more thing, girls. Why are you all obsessed about the quantity of breast milk? Why don't you talk about the quality of breast milk? Tell me one example. If there are two mothers, one mother is producing 30 ml at one go, and one mother is producing 60 ml at one go, and both the babies are having same weight gain, then the mother who is producing 30 ml of breast milk, is her milk less? Think about it. It's no. It is always about the quality of breast milk also. If both the babies are gaining same amount of weight gain, and one mother is pumping and she's getting 30 ml, and the other mother is pumping and she's getting 60 ml, that doesn't mean that the 30 ml mother's breast milk is less. It means she has better quality of breast milk. So that's why please don't be obsessed about the quantity of breast milk and getting discouraged about it. You have to say the baby's weight gain. If your formula milk is coming down and baby's weight is going up, that is all what we want. And nobody of you check the baby's weight. I am after every mother to keep checking the baby's weight. And when they start seeing their weight gain of the babies, they feel so good. They feel so confident about their breastfeeding. And this is what which all of you have to do. Check the baby's weight. If the baby's weight is increasing and the baby's formula milk is coming down, you're on the correct path. Then why do you fight about how much amount of breast milk I'm producing? Let the nature work on that. Okay. Next question is from Aish. Doctor, I exclusively breast pump and feed my baby. My baby is 6 months old. So can I skip pumping during night time? So now do one thing, Aish. Try reducing slowly. So suppose, for example, if you are pumping for 15 minutes and doing it at regular intervals, at the night first start reducing the time first. Okay. So your body will not It will get adjusted as per your protocols. Then make the time as becoming that 5 minutes. Then you can start reducing the one pump session. And also your baby is now 6 months old, so you can start giving solids to your child. So this way the dependency on milk will reduce. This way you will be able to reduce the pumping sessions in the night. Okay. Next question is from Anusha. How to latch 5 months old baby from bottle to breastfeeding? Good question, Anusha. So what you have to do, every time your baby demands milk, you first try to put the baby on the breast. Please, I'm using the word try. Try doesn't mean that you will be successful every time. You just try to put the baby on the breast. If the baby doesn't come on the breast and starts crying, it's okay, relax. You give the bottle to the baby, but once the baby takes half of the bottle, remove the bottle and take the baby back to the breast. Again, the baby starts crying, it's fine. Now, give the remaining bottle to the baby and your milk you will pump. So always remember, girls, you all just got discouraged by once or two of trial. Many mothers tell me, I try once a day. It is not like that. You have to try for every feeding session. Make it as a ritual just. Just do it. We all pray, but we haven't seen God yet. But we all pray now, keeping in mind that there is God. So just do it as a ritual. Do it regularly. Do it consistently. And guaranteed, girls, if you're doing consistent efforts, you will definitely see results. It is never like that nature will not help you. Your body is tremendous. It is like miraculous. It will definitely give you results. But you have to give consistent efforts. I see mothers during Diwali, they will say that I am going to my mother's place, I'm going to my in-laws' place. I will not be able to do, ma'am. Arey, why? Diwali will come every year. You have to work hard this year. This year is a crucial year for your baby. Just work on that. Okay? I know you might be thinking, yes, ma'am, you are saying, but there are a lot of things at my home. There are so many people who are saying that, this. But you are the person who has to take the decision for your baby's health. And when you are strong about taking the decision for your baby's health, there will be no one who can stop you from doing that. Okay, so this you have to be strong in taking the decision that I need to do exclusive breastfeeding. When you will watch the Mom Star series, which I just told you about on my YouTube channel, you will see those girls who had been so obsessed about breastfeeding. And I say, if you have to breastfeed, you will have to focus you have to give me some time of yours. But I will make sure that it has to be done regularly, but it will always be about, you have to give that time and consistent efforts. Next question is from Adar again. Ideal time for cluster pumping at night to increase milk supply. It is not about cluster pumping. Why do you want to do cluster pumping? First, if you are, suppose you're starting out, then don't go for cluster pumping. I'm sure you're asking about cluster pumping as power pumping. So don't go for power pumping immediately when you are starting pumping. First, get in a habit of pumping. Pumping is not easy. Pumping is very difficult to do. Pumping is difficult than doing breastfeeding directly. So if you are doing pumping, then first get in a habit of doing pumps regularly and then go for the power pumping. So when you are talking about the ideal time, that is between 12 to 5. Between 12 a.m. to 5 a.m., there is prolactin in our body, which helps to improve the breast milk supply. So that time you can do cluster pumpings or this power pumping between 12 to 5. But once you have got accustomed to the pumping schedules. Next question is from Jaymeet Kaur. How long it takes to show 100% results of relactation? That will depend on what is the age of your baby and for how long your baby has taken breastfeeding, or what was the last time when you produced how much of breast milk. So there are many things when we consider about relactation. First of all, what is the age of the baby? Second of all, what has been the history of a mother? So recently a mother came to me. Her milk supply was very good in the initial days. She used to leak. She used to have a lot of milk in the beginning, and she was not knowing about the demand and supply, and she had to go for an abscess surgery, or she developed an abscess and she had to undergo an abscess surgery. After the surgery, nobody guided her well, and her baby started coming on the bottle feeding and got habitual to bottle, and the baby was on exclusive formula feeding. Recently, she came to me for relactation. I just took the history, and I was very sure that this mother will make milk very fast. I started working with her. Within 1 week or 10 days, she started making 60 ml to 80 ml per day. Slowly, we started working on her. Now she's making around 250 ml per day. It is nearly, I think, 2 weeks or 3 weeks. So this will all depend on what is the history of a mother. First of all, as I told you about the age. Second thing is about how long the baby has taken breastfeeding before. Or if we are talking about not only about breastfeeding, if the mother has pumped previously, what was the milk supply previously? So all these things are considered when we talk about relactation. And once we discuss it on the first consultation, and then we ask the mother to come the second time. Then we see the results of last 1 week. After seeing the 1 week results, there is a better chance of telling how much time it will take to get 100% success. Okay. Next question is मोरिको टैबलेट्स को कितने टाइम लेना है? सो अगर आप ब्रेस्ट मिल्क सप्लाई को बढ़ाना चाहते हैं तो आपको 3 टाइम्स से स्टार्ट करना है. अगर आप मेंटेन करना चाहते हैं अपनी बॉडी के लिए, आप मतलब न्यूट्रिशन के लिए वर्क करना चाहते हैं तो 2 टाइम लेना है. Next question is from Shresha. How to increase supply? So Shresha, I have just answered that. Just watch the recording of this. The recording of the video of today will go on YouTube channel also and will also be on Instagram. Next question is from Dinni. Relactation after 5 months of giving birth. Yes, Dinni, you will be able to do it, relactation after 5 months. Absolutely, yes. But what we need to work on is consistency. Please try to do it persistently. Next question is from Jaymeet. I have started last week. I am producing around 200 ml babies, 4 months, 15 days old. Awesome, Jaymeet. It is 200 ml you're already doing, dear. It's very good. Just keep moving. Okay. Next question is from Mercy. Easy techniques to bring the baby to the breast. Easy techniques is the best thing if you are feeding your baby on demand and not waiting for the baby to cry. See, if your baby starts crying, the baby will become very fussy and will want fast letdown of milk. So if you want an easy technique, then do demand feeding, and that too by seeing the signs of the baby. How you will see the signs? The baby will start moving the head, or baby will be more active. You will see that the baby will, and also you can check for the rooting reflex. You just check around the baby's mouth, and if the baby moves his mouth towards your finger, that means baby has become hungry. Put him on the breast. So that is the best time when you will be able to do it effectively and in more easier way. So easy techniques to bring the baby on the breast. Next is a comfortable position. Always sit straight. Don't bend down. If you bend down, you will have backache, which will really hurt you bad, and you will leave the breastfeeding faster. So that's why have a comfortable position. Sit straight. Have pillow below you. Put the baby on the pillow and have sufficient height. If you want 2 pillows, 3 pillows, just put them, but have a sufficient height. If you don't have a feeding pillow, you can have 3 pillows, as I just told you. Otherwise, feeding pillow. For some mothers, I even advise them to put a pillow below the feeding pillow also, because sometimes the feeding, every mother is different, and obviously sometimes we need more height. Then put the baby on the breast and let the baby face you. Baby should not be like this. Always the baby should be looking at yours. Baby should be skin to skin with you. Then holding the baby in the cross cradle hold if your baby is less than 3 months. If the baby is more than 3 months, then you can just do a modified cross cradle hold where you can lie down the baby and bring your hand above the shoulder of the baby. Then holding the baby's head. It should be from the head behind the ears, and you should hold the baby like this. And then now if you have to gulp, if you have to drink some water or liquid, then it will be easier for you if you're opening the neck. If the neck is inside, like if the baby is looking down, it will be difficult for the baby to gulp. That's why try to open up the neck. So that you can do by extending the head. Extending the wrist. So by this wrist movement, you have to just extend the baby's head. The baby head should be like this. Now, once you are bringing the baby on the breast, how to hold the breast? Breast should be held in U shape from below, not C shape from side. Many of you do this mistake. You hold the breast C shape from side, not like this. You have to hold U shape from below. Now, what is the concept behind this? See, when you're eating a vada pav or a burger, you have to hold the burger like this. If you're holding the burger like this, you will not be able to take a big bite. So you have to hold the burger like this. Now see the fingers. The fingers and your lips are parallel to each other. Now when we are bringing the baby on the breast, now if you are having the baby like this, imagine the baby's lips will be like this. If the baby's lips are like this, then what should be the hold of the breast? It should be like this, parallel. It should, if you are holding the breast like this, then the baby's fingers should be like this, lips, I mean. This is the ideal position. So now holding the breast like this, bringing the baby on the other side and extending the head. Now the chin should touch the mother's breast first. When the chin is touching to the mother's breast, then tickle your nipple on the baby's upper lip. So baby will open a small mouth like this. Many of you say that the baby doesn't open a big mouth. It's fine. If the baby is not opening a mouth, then you have to take this hand and do the baby like front and fro, just like this. Like you're teasing the baby and not giving breastfeeding to the baby. The baby will get irritated and the baby will like open a big mouth and will do that. And that time take the baby inside. Once the baby has latched, then you have to observe one thing. The lips should be turned outwards. Lower part of the areola should be in the baby's mouth. So how you can do that? Once the baby has latched, same wrist movement. Just move the wrist like this, back. When you do this, the chin will be inside, the nose will be back. This way you will be able to have an easy technique. Yes, I might be sounding like that easy. It is not easy, but not impossible also. If you are doing it consistently with your child, you will definitely have a deeper latch. But you have to do it regularly and better to do it under a guidance. When I talk with my mothers, I ask them to send regular videos of latching and I work on that. I see the latch videos and I advise the mothers what to do ahead. So girls, you will be able to do everything, but the only thing is consistency, perseverance, and guidance under an expert. If you're thinking by taking any free tips on by just going Googling and by just watching YouTube videos, if you're thinking of this, your time will pass away and you'll keep getting frustrated about it. That is why get the results faster, get a help of a guidance and do the things resolve. Right now, I have 3 more doctors in my team and we are working day and night on these things to get the things resolved. My consultations are getting booked for 2 weeks. I know many of you have this complaint that my consultations are getting booked for 2 weeks. But I have got 3 more doctors, girls. Come on, you will be able to do it. And I'm getting more and more doctors in my team, training more doctors on these all things. But you have to take the first effort. And it is not only about just getting first consultation. We are also giving renew consultations. We are giving assessment calls. Take the help of those things and get your issues resolved, girls. Okay? Now, moving ahead. How to manage pumping while traveling? Can 2 to 3 days trip impact the supply if not followed actual routine? So now it will all depend on what is your demand and what is your supply. So if your supply is good, you can store some breast milk and you can carry with you. And if you have to maintain the milk supply, what you can do, just take out the milk. Just don't think of getting a proper pumping routine at when you are going or traveling outside, but keep expressing the milk. You can even hand express and discard the milk if you don't have any storage at a place. But if you are doing it regularly, the milk supply will not go down now. Okay. Next question is from Aparna. How much time can baby sleep between feeds? She's 2.5 months old. This will vary whole day. In the mornings, you will feel she will feed lesser time. She will sleep more. In the evening, she will take regular feedings between, and especially 2.5 months, the baby will be going through a growth spurt phase, the pre-growth spurt. The baby will be taking frequent feedings also. So don't worry about the timings. It will be varying. So right now, you just need to work on demand feeding and keep seeing the active feeding, which I told you about the gulping movement. Next question is from Manisha. My baby is 1 month old and still facing latching issues. So if you're facing latching issues, just make a 1-minute video, send it to the team. And if you're already in my consultation, just send your 1-minute video and I'll see that and I'll tell you on what to do. And then you just work on it and resend me the video. Next question is from Shruti. Baby not satisfied after feeding long duration. Then if the baby is not satisfied, then for every feeding session, just start initial session, then mid-bottle feeding, and then lastly, you just pump. So every feeding session, if you are doing demand for every thrice per feeding session, definitely the milk supply will improve. And also just work on the tips which I just told you about how to increase the milk supply. Next question is from Mrs. Akram. My 5 months की बेबी को ब्रेस्ट पर लाना पॉसिबल हो सकता है क्या उसने एक मर्तबा भी ब्रेस्ट फीडिंग नहीं लिया है। तो अगर ब्रेस्ट फीडिंग कभी नहीं किया और बच्चा ऑलरेडी 5 मंथ्स का है, तो पहले आपको देखना है कि आपका मिल्क सप्लाई कैसा है। अगर आपका मिल्क सप्लाई बहुत अच्छा है तो मैं आपको टिप्स बताती हूँ, मैंने बताती भी रहती हूँ मैं यूजुअली वेबिनार्स में। आप उसको ट्राई करिए, अगर उससे वर्क नहीं हो रहा है तो फिर टीम के साथ मिलके अपना इश्यू रिजॉल्व करिए। लेकिन 5 मंथ्स के बेबी को ब्रेस्ट पे अगर लाना है जिसने पहले कभी भी फीडिंग नहीं किया है, वहां पर आपको रेगुलरली एफर्ट करने पड़ेंगे। आप सिर्फ 1 या 2 बार ट्राई करते हो अगर पूरा दिन में, उससे काम नहीं चलेगा। हर फीडिंग सेशन पे आपको ट्राई करना होगा। मेरा भी एक 10 महीने का बच्चा ब्रेस्ट पे आया है, तो इसलिए आप कर सकते हो, लेकिन आपको इसमें कंसिस्टेंट एफर्ट्स करने होंगे। So that's all. Now let me take another live or the live questions which have come in the Q&A box. First question is from anonymous attendee. मैम, मेरा बेटी 6 मंथ्स की है, बॉटल से ब्रेस्ट फीड लेती है, उसे डायरेक्ट ब्रेस्ट पर लाना चाहती हूँ। मिड बॉटल फीडिंग ट्राई कर रही हूँ बट कोई फायदा नहीं होता, वो रोना स्टार्ट कर देती है, तो रोती है। मैं सोते वक्त सिर्फ मुंह पे लेती ही, लैच नहीं करती, क्या उसे दोबारा ब्रेस्ट पे लाना पॉसिबल है? देखो, अगर 6 महीने की है और आपने कहा कि मिड बॉटल फीडिंग पे, अभी कितनी बार ट्राई कराते हो ये मुझे इसमें लिख करके अभी मैसेज करो कि दिन भर में वो कितनी फीडिंग लेती है और आप कितनी बार ट्राई कराते हो, ये मुझे लिख के भेजो, मैं भी दोबारा इसको आंसर करूंगी। नेक्स्ट क्वेश्चन इज फ्रॉम कांता. PRL affect the breastfeeding? So PRL, always remember the when we talk about breastfeeding, then prolactin is more increased during breastfeeding time, and prolactin is good for breastfeeding if the like range is little higher from your uh, normal range, that is fine. So Kanta, what I would suggest right now, don't go for all these fancy things right now. If there is some problem, then go for it. Otherwise, just breastfeed your baby. Breastfeeding, the prolactin hormone is important for breastfeeding. So for a lactating mother, PRL, prolactin hormone will be on a higher side. If it is on a lower side, just try to do the regular methods like pumping and like regularly feeding, trying. The prolactin will naturally increase in your body or in your body. If prolactin is on a higher side and little higher side, then don't worry. It will be all okay. Don't worry at all. Okay. Suno, mujhe isme pani do. Next question is from Dinini. Can you guide me relactation after 5 months of birth? Dinini, I already answered your question. It was there in the Google form. Next question is from Chetna. How to manage a direct breastfeeding session along with pumping in order to stash milk when the office starts? Just a minute. I'll tell you. What you do, you directly breastfeed every time. Now, once you have completely breastfed your baby, wash the color of the milk. If the color of the milk is thick white, that means your baby has not emptied the breast and there is still milk in the breast left. That time you can pump for 10 to 15 minutes. If your baby has fed and you will see translucent milk, then that means the breast is empty. But if you create a stash, then just pump for 5 to 10 minutes. This milk you can start storing and slowly you will start seeing that improvement in milk supply. It is because you are creating more demand, then the supply will also definitely increase. Along with that, improve your water intake, take Lactomagic powder and Morico tablets. That's all, Chetna. That will help and you will be able to create enough stash when you start going for your office. Next question is from Lavanya. How do I know that my baby is getting enough milk? I always feel that I am not producing enough milk. I am a new mom of 16 days old. Hey Lavanya, you're just a 16 days old mother. It's okay. If your child is a newborn, you are a new mom of 16 days old. So it is a new phase of your life. It's okay. Please don't get stressed out. And don't always be in a stress that I am not producing enough. I am not producing enough. It's okay. Your 16 days old will sleep a lot. The sleep cycle will be 14-15 hours per day. So relax. What you can do, your doctors would have asked you to feed every 2 hours. I understand it's not easy every time because the baby keeps sleeping most of the times. What you can do, you try to breastfeed your baby. And if your baby is not breastfeeding, you can have a hand express, or you can just pump for a few minutes. Don't sit for long hours with a pump. Just hand express, or you can pump for a few minutes, collect that milk and store it. You can room temperature, you can keep the milk for 3 to 4 hours. And the next time your baby gets up, you first try to breastfeed. If the baby is still not getting up for the breast, like for breastfeeding, whatever milk you have collected, just try to give with a spoon in the baby's mouth. That will open up his mouth and he will be aware, and then you can put him on the breast. And yes, keep seeing the weight of the baby. By 15th day, your baby should come back to the birth weight. If your baby has come on the birth weight, very good. Now start seeing 200 grams per week. If your baby is gaining 200 grams per week, definitely, girl Lavanya, just relax. You are producing enough breast milk. Don't worry at all. Next question is from anonymous attendee. I am on 1 month breastfeeding. My baby doesn't latch properly and sleeps on breastfeeding. She is mostly cranky and fuzzy. If it's a 1 month baby, obviously the baby's sleeping cycle will be more. So if you are seeing that the baby's sleeping on the breast, just observe the gulping signs. If you are seeing the gulping signs, the baby is breastfeeding. If you are not seeing the gulping signs, that the baby is doing a passive feeding. Remove the baby from the breast. And if you're seeing, then you see the color of the milk. If the color of the milk is thick white, you just hand express or pump and store this milk on room temperature. So just keep doing this. Don't worry if she's sleeping, and this way you will be able to collect the breast milk. You will be able to increase the breast milk, and also you will be able to breastfeed your baby in a peaceful way. And then at the last, see the weight. 1 month baby should gain 200 grams per week. Next question is from Bhavna. Ma'am, I have twin babies. One baby is drinking good, but the other baby is drinking some milk and she's leaving my breast. So when I try to burp, she's again crying for milk. But I have milk. When I press milk, my breast is having milk. So what should I do? See, every baby is different. One of your child is drinking good. That means the latching is good. When the other baby is leaving the breast and she's crying after some time, that means she needs to work on latching. So one of your baby has got settled. That is very good. Now try to work on the latch. So just few minutes ago, I have given you very good explanation of how you can get good latching for your baby. Latching is not easy. You have to work on it persistently. So if you are under consultation with any of my doctors or me, then just keep sending us your videos. We'll work on it and we'll keep guiding you on how you can improve your latching. If you're not under the guidance, just go for a guidance and just keep sending the videos, and it will improve with like guidance. We'll keep guiding you on how you can improve the latch. Next question is from Jaymeet. What should be the ideal pumping routine? So Jaymeet, as what I remember, you just told me your baby is 4.5 months old. So when you talk about an ideal pumping routine, you should be pumping around 7 times. And if you are doing 7 times of pumping, that should be mostly 10 minutes of pumping. If you are trying to increase the breast milk, then you should add some, because you have been pumping for long. You just told me you are producing some amount of milk, which was good. So if you have to now work, then obviously you have to start doing the power pumps now. For you, I'm talking about Jaymeet. Okay. So for you, you should be adding now the power pumps, which will further improve the milk supply. And if you're already good and your milk supply is already good and you are only maintaining, then 7 times of at a 4-hourly pump is perfectly fine for you. Next question is from Ankita. Ma'am, मेरी बेटी 30 months की going to complete 3 years, but she needs breastfeeding daily in sleep time. Please help me out. See, Ankita, if you are good and feeling good with your child breastfeeding, then what is the worry? If you are having problem in feeding your 3-year-old child, then tell me. So if you are only worried because people are telling you to stop breastfeeding, then please don't listen to them. If you are having problem to breastfeed, then write it to me. I'll write in the chat box. I'll tell you what you can do. But if you are having no problem and you want to breastfeed your child, then don't listen to anyone. You can breastfeed your baby as long as you want. Next question is from Elora Banerjee. After 3 months, is it possible to get breast milk supply? Yes, definitely, Elora. You can definitely improve the breast milk supply even your baby is 3 months old. My supply is dripping while baby is feeding, but baby is already on formula. It's okay, Elora. It is all about demand and supply and improving the other factors to improve the breast milk supply. definitely you will be able to improve the milk supply for 3 months old baby. I have already given in this webinar on the tips on how to increase the breast milk. You can watch the recording, and if you need further guidance, because baby is already 3 months old, so now don't waste time and get your consultation done and resolve this issue as fast as possible. Next question is from Meenakshi Verma. Good evening, ma'am. I have no milk supply, only some drops. Can it increase? Because my family mother-in-law says it will never come. Please suggest me what should I do. First of all, don't listen to your mother-in-law who said that it will not improve. It will definitely increase. And if you said that I have no milk supply, only drops, then still the drops are coming. You can definitely increase the milk supply further, Meenakshi. The tips I have already given in today's webinar. You can see the recording. And if you want to get it fast and want to resolve it fast, reach out to our doctors. Reach out to the team tomorrow and get your consultation done. Next question is from Kanta. How I can give my express milk to my child because he didn't like to drink the cold milk? Hey, I said, don't give cold milk, Baba. Just warm it in a double boiler. Do one thing. So Kanta, you have express breast milk. What you do, you take a utensil and warm water into that. And then take this container of milk and put it into this warm water or hot water. The milk will get heated up, like warmed up, and then you can give it to your child. Nobody likes cold milk. Your baby doesn't like cold milk. That is good. The baby should not drink cold milk. Otherwise, the baby will have cold. So don't worry, Kanta. Just do what I just told you, and your baby will be happy. Next question is from Bhavna. She's not latching properly. She's not satisfied. When I'm checked, my breast, it is having milk. But what should I do? As I just told you about latching, Bhavna. So just send a video of yours on the helpline team if you're already into our consultation. I told you, your one baby is already latching. The other one is not latching properly. So we'll work it on out and you know how to latch. It's just basically some things which you might be missing somewhere. Let us work on it and get the issue resolved. Your baby, one baby is already breastfeeding. It is the young one, this is the second one which you have to work upon. So don't worry, Bhavna, it will be okay. So next question is from Dinini. Doctor, does domperidone tablets increase milk supply? If yes, how much should we take? Further, is it possible to repeat the tablet and powder you have mentioned? Morica tablets, lactomagic powder, isn't it? So Dinini, first of all, for domperidone, because it is an allopathic tablet, it should be taken only under the doctor's guidance. It is not a supplement. It's an allopathic tablet that should be taken only under doctor's consultation. So I will not talk about domperidone in this webinar because it is a public platform and discussing allopathic medicines on a public platform is not correct. When I talk about the supplements, yes, supplements you can take. If you are trying to improve the breast milk supply, then take on a higher dose. If you are only on the maintenance, take on a lower dose. Okay. Meenakshi, I have already answered. Why are you sending question again and again, beta? Next question is from anonymous attendee. Hello, ma'am. My baby doesn't show signs of hunger or cry even if not fed. My baby's age is 3 months old. I am doing combination feeding. So how can I know if my production is increased? And whenever hand express, there is good supply. Sometimes I also leak little milk when feeding with other. I'm already on your treatment, ma'am. Hey, good, na? So if you're under my treatment, dear, your baby is 3 months already, and you said that baby is doing combination feeding. So what you do, you say that how to know that my production is increased. Then you have to see the weight gain of your baby. Your baby is 3 months old now. So right now the baby would be gaining around 150 grams per week. If the baby is exactly 3 months, you will not see the weight gain for 1 or 2 weeks. It is perfectly fine. After 1 or 2 weeks, you will start seeing the gain. It should be around 150 grams per week. If it is happening, then start reducing the formula milk. If you're under my treatment, we'll discuss on this on our next call, how to reduce the formula milk. But just keep a tap of the baby's weight and come to me on my next call. We'll discuss on this and we'll remove the formula milk accordingly. And also when you say that on hand expression, the milk supply is good, you're doing good, my dear. Just keep doing. And if you're leaking milk, although leaking milk is not a sign of making overproduction of milk. Leaking is a sign that you have a good oxytocin reflex. It doesn't mean that you have a lot of milk and milk is overflowing. So leaking is not a sign of overproduction. Leaking is a sign of good oxytocin reflex. Okay. Next question is from Ankita. Jamie says, thank you so much, ma'am. You are most welcome, dear. Next question is from Ankita. I am feeling weakness, tiredness. ये रीजन हो सकता है क्या? अदरवाइज आई हैव नो एनी प्रॉब्लम. आफ्टर डिलीवरी आई वाज टेकिंग एनी सिरप फॉर यू कैन यू टी सजेस्ट एनी सिरप फॉर मी जिससे मेरी वीकनेस ना हो. तो अंकिता, अगर आपको आपका 3 साल का बच्चा है और आप ब्रेस्ट फीडिंग करा रहे हो और अब आपको ये लग रहा है कि मैं उसकी ब्रेस्ट फीडिंग छुड़ा दूं, और मैंने आपसे जैसे पूछा कि अगर आपको कोई प्रॉब्लम है तो आप बताओ, तो आपने बोला मुझे वीकनेस हो रही है, टायर्डनेस हो रही है, तो मैं ब्रेस्ट फीडिंग कम करना चाहती हूँ. अगर आपकी वीकनेस और टायर्डनेस के लिए मैं कुछ तरीके बता दूं और वो चीजें ठीक हो जाए, अगर आप ब्रेस्ट फीडिंग आगे कंटिन्यू करना चाहते हो, तो आई विल बी वेरी हैप्पी. क्योंकि ब्रेस्ट फीडिंग एक ऐसी जर्नी है, ये माँ और बच्चे का आपस का ऐसा बॉन्ड है जो जितना लंबा चल पाए उतना अच्छा रहता है ना हमारे लिए. तो वीकनेस और टायर्डनेस के लिए आप प्रोटीन लोगे. अगर आप वेजिटेरियन हो तो आप स्प्राउट्स रेगुलरली अपने खाने में लोगे. मूंग का, चने का, लोबिया का, इनका स्प्राउट्स बनाओ. और अगर आपको स्प्राउट्स खाने में डिफिकल्ट हो रहा है तो आप उसको क्या करो, मिक्सी में पीस के अपने आटे में मिला लो, उसकी रोटी बना लो. दूसरी चीज है, स्प्राउट्स की सब्जी बना सकते हो आप. लोबिया की सब्जी रेगुलरली अपने खाने में यूज करो. तीसरी चीज, जितने भी होल ग्रेन्स हैं उनको एक डब्बे में भर लो. रात में सोने से पहले उसमें से एक मुट्ठी लेकर के पानी में भिगो दो. सुबह उसको पानी निकाल करके उसको मिक्सी में पीस करके अपने आटे में मिला लो. ये चीज है, क्योंकि जो होल नट्स, होल ग्रेन्स होते हैं, उनका जो ऊपर का शेल होता है उसमें प्रोटीन होता है. ये आपकी हेल्प करेगा आपकी टायर्डनेस को दूर करने के लिए. दूसरी चीज, अगर आप ब्रेस्ट फीडिंग मदर हो, 3 साल का बच्चा है आपका और आप फीडिंग करा रहे हो अभी भी, तो आपको फीडिंग के साथ साथ आपको अपने पानी, 3 लीटर पानी रेगुलरली पियो. साथ में सीजनल फ्रूट्स खाओ. नट्स एंड सीड्स का थोड़ा थोड़ा अमाउंट थोड़ा थोड़ा लेते रहो. और अगर नॉन वेजिटेरियन हो तो 2 अंडा रेगुलरली खाओ. हफ्ते में 3 बार अपना प्रोटीन, मतलब अपने नॉन वेज रेगुलरली खाओ. अगर नॉन वेजिटेरियन हो तो इस तरह से करो, वेजिटेरियन हो तो जैसे मैंने पहले बताया वैसे करो. रेगुलरली अपने फूड में जितना प्रोटीन लोगे उतना अच्छा है. नेक्स्ट चीज, अगर नॉर्थ इंडिया में हो, इस समय सर्दियां पड़ रही हैं, इस समय हम लोग जो गरम वो बनाते हैं ना, भाकरी बनाते हैं, ज्वार की रोटी वगैरह बनाते हैं, ये सब चीजें अपने खाने में रेगुलरली लो. सीजनल फूड्स रेगुलरली लो, उससे आपका न्यूट्रिशन अच्छा होगा. आयरन लो रेगुलरली, और आयरन के साथ साथ विटामिन सी लो. जैसे पालक का साग, इस समय सर्दियों में पालक का साग, सरसों का साग आ रहा है, उसमें थोड़ा नींबू निचोड़ करके खाओ, तो आपकी बॉडी में थोड़ा आयरन जाएगा. अपना एक बार हीमोग्लोबिन चेक कराओ, अपना एक बार थायराइड चेक कराओ. हीमोग्लोबिन और थायराइड अगर दोनों चीजें नॉर्मल है तो जो मैंने अभी बताया उससे चीजें ठीक हो जाएंगी. अगर थायराइड कम है या ज्यादा है, अगर आयरन हीमोग्लोबिन कम है, तो उस पर वर्क करो अंकिता, ठीक हो जाएंगी चीजें. ठीक है बच्चे. Next question is from Ranju. Thank you so much, doctor. From your team, I am exclusively breastfeeding my 6 months old baby who was completely on formula from day one. Oh, awesome, Ash. That's a great story. So, everyone, there is a success story in our chat box, and she's an exclusively breastfeeding mother, and she's a 6 months. What is your full name? Because isme I am getting only Ash Ranju. Please write your name in the chat box so that I understand what is your full name. And congratulations, my dear, that you got results from our team, and your baby was on formula milk from day one and now on exclusively breastfeeding. So you're our next mom star. Who are you? Please write your name in the chat box, and our team will try to reach out to you. And we want you to see on our next mom star, dear. Okay? So please write your name in the chat box. Next question is from Rutij Teja. I am having too much of hair fall due to breastfeeding. What to do? प्रोटीन बाबा खाओ. हेयर फॉल हो रहा है ना, प्रोटीन खाओ ना बाबा, ये तो सर्दियों का टाइम है. So you will have hair fall. Have protein. I just guided so detail on protein. Work on protein, dear. And yes, obviously your iron and your this one. Take vitamin C along with it. Next question, Ankita. Thank you so much, ma'am. Most welcome, my dear. Next question. अरे हो गए. That's great. So we are done with the questions today. Good. So it is also almost 1 hour. Okay, girls. So good to see you all here today. And I'll try my best to be live regularly on Fridays. And because of Diwali last week, there were very less of you all were active. Mostly you all were busy in the holidays and all that. But now we'll try to be active regularly on Fridays, and we'll have this Q&A sessions regularly. Okay. So have a very good weekend. And I know with babies, you are not having any weekends. It is almost every day the same day, but that's completely fine. It is a phase. It's okay. Don't worry that your life is revolving only around your baby. It's okay. I know, because now my babies have grown up. My kids have grown up. Now I really miss that time. So Aishwarya Chetan. Okay, that's great, Aishwarya. Congratulations again that you are now on exclusively breastfeeding. So sorry, doctor, my baby is on exclusively on breast pump feeding, trying to get her on the breast as soon as possible. So definitely, Aishwarya, you will be able to have breastfeeding also. And please just work with the doctor. She will guide you on getting the baby also on the breast also. But exclusively on breastfeeding with the pump also, that is a great thing, Aishwarya. That's great, dear. I'm so happy for you, and congratulations again to be our next mom star. And Treja says, I am having lumps in the breast and I am continuing breastfeeding for past 5 months. So if you are having lumps in the breast, do oil massage on the breast and do warm compress and then feed your baby. The lumps will all go away with it. And okay, so it's a bye from me. All for all of you. Take very good care of yours also along with your babies. And keep taking good care of yours. Keep taking good nutrition. Keep following the protocols if you are already our patients. Keep following the protocols. Nobody should leave the protocols. Okay, and do it properly and get your babies on exclusive breastfeeding and enjoy the benefits of breastfeeding. It's an awesome, it's a miraculous thing, and you will love that bond which you have with your child. Okay, take care. Bye bye, girls. Bye bye.